Ferriprox, also known as deferriprone. What is Ferriprox? It's a prescribed synthetic medicine that gives treatment to iron overload through blood transfusions in individuals that have thalassemia syndromes, sickle cell disease, or other anemias. Chelation therapy is how Ferriprox is used today. When metals such as lead, mercury, arsenic, or iron enter your bloodstream, it could be poisonous to your body. In this case, chelation therapy is used for iron in your bloodstream. How does chelation therapy work? There are 4 steps to receive chelation therapy. Step 1. You will receive a blood test to make sure you have metal poisoning in your blood. Step 2 is receiving chelation treatment. You receive the chelation medicine through an IV that is in the patient's arm. If the patient would rather not have an IV, they could receive the same treatment but in pill form by prescription. Step 3 starts once the medicine is injected into the bloodstream. The medicine uses special drugs to bind to the metals that are running through the patient's bloodstream. Lastly, step 4 occurs once the drug binds to the metal and the patient's body will remove the drug and the metal through urination. Ferriprox treatment is very important as it's been used for around 20 years and has proven to lower the amount of cardiac iron load along with increasing cardiac function. Obviously, our heart's functioning properly is vital, but in anemic patients, cardiac cirrhosis, which is a condition where iron builds up in the heart's ventricles and atria, is very prominent. If we do not have Ferriprox treatment, the death rates would increase in anemic cases because of the iron building up in important organs. Red blood cell transfusions is very vital for those who are diagnosed with sickle cell disease or other anemias. Red blood cell transfusions are helpful because it gives a chance for the new red blood cells to mature and pair with hemoglobin. The hemoglobin will move oxygen that the cells need. But the more red blood cell transfusions there are, the more complications that can occur, such as iron overload, since the red blood cells that are being transfused contain iron and then there's too much iron in the patient's blood. This can be very damaging as iron overload can negatively affect organs such as the heart and the liver. There are known side effects and challenges of the Ferriprox treatment. The side effects of taking the oral medication can be nausea, vomiting, stomach discomfort, diarrhea, joint and back pain, abnormally increased appetite, and headaches. Alone, these symptoms are bearable, but sometimes they can cause other problems within the body. The side effects listed can cause issues in the blood and lymphatic system. This can be disorders, gastrointestinal disorders, investigations, metabolism and nutrition disorders, musculoskeletal and connective tissue disorders, nervous system disorders, and urinary disorders. Ferriprox is a very helpful drug, but can cause complications, including women who are pregnant or breastfeeding cannot be on it. Along with patients who are getting an infection, the treatment needs to be stopped temporarily until the infection goes away. Also, men and women who are on Ferriprox need to use effective birth control because the medicine can cause harm to the unborn baby. Women should continue to use birth control 6 months after the last dose. Men should use birth control until 3 months after the last dose. The future for Ferriprox treatment is the creation of new medications and treatment for other diseases, such as Fabry disease, which causes multiplication of GB3, which settles in blood and blood vessel walls. They are working on a new synthetic treatment to help prevent this from occurring. PRX-102 is being chemically modified and being tested in labs. This was inspired by Ferriprox treatment. And these are my references.